It's my feel-good breakfast show.
Welcome back, everybody. It is your Feel Good Breakfast Show here on S3. Today, we're celebrating International Women's Day, and it is a global holiday celebrated annually on the 8th of March to commemorate the cultural, political, and socioeconomic achievements of women all over the world. Now, in honor of this day, we are focusing our health discussion on all things women's health. And joining us this morning is longtime friend of the show, gynecologist and obstetrician, Dr. Jason Bennett. So good to have you.
Jamie, thanks for having me back.
So good to see you in your scrubs as well. Normally we see you in a suit. Today you look like a doctor today.
Much more practical.
These stats are so scary. I mean, something I didn't know, that the leading cause of death in women is heart disease. That is so scary to think of that. And I believe that the symptoms that women experience when it comes to a heart attack and heart disease is so different to men. But what are some of the signs and symptoms that women should be looking out for if they think that they're going to be suffering from heart disease or a heart attack?
That's so true. It's actually more common than anyone actually thinks, and 1 in 5 deaths of women are caused by heart disease. So the symptoms or signs of a heart attack in women can be a little bit different to a man. They may have no symptoms at all. They may notice a little bit of shortness of breath. They may be a little bit fatigued, a little bit tired, but then they also may get some pain in their chest that radiates to the back, and it can also move to their jaw.
Why is it? Why is it so different from women to men?
I mean, everyone presents differently, especially with heart disease, and it's just one of the things that they've picked up, that women have to be a little bit more vigilant for heart disease.
And I think being vigilant also makes sure that you're checking in on your health on a regular basis.
Exactly.
And going for tests from a young age to when you're a woman. And some of these tests needs to be done at a very early age. So what are some of the tests that women need to focus on?
Yeah, so there are a lot of tests that women can focus on, and as I always say, prevention is better than cure, and we'd rather implement these tests from an early age. Some of the most popular ones, or ones that most well-known ones, are the Pap Smear, that no one likes to go for, but it is extremely important, and you can really decrease your chances of getting cervical cancer by having a Pap Smear. Other things are a mammogram, breast self-examinations, bone mineral density tests, checking your iron levels, checking for diabetes, and also checking your blood pressure.
Okay, got it. I got mammogram bone density test. That's a new one. Is that a way to prevent osteoporosis?
Yes, you're right. So bone mineral density test is a special type of kind of scan of a woman's body. And what it will do is pick up if her bones are weak or brittle, or if they are strong enough. And we often see it in postmenopausal women when their estrogen levels have dropped significantly and their bones become very weak and brittle, and they have a high chance of breaking their bones very easily. If we can pick this up early, we can try and prevent it or treat it. We can treat it by either giving calcium, vitamin D, or giving some special medicines orally or intravenously, so kind of in your vein, to prevent the bones from breaking down so quickly.
And we say early. When would you recommend is an ideal time for women to start with these health checks?
So a Pap Smear, so we say your first Pap Smear should be 1 year after having sex or being intimate with someone, and then every 2 years after that. Your first mammogram, so it does change based on your family history, but in general, your first mammogram should be from the age of 40, and then every 2 years after that. Obviously, it may change if you have more risk factors, okay? A breast self-examination is kind of the easiest test for a woman to do. And we say as a woman starts having her first period, she should start doing her own breast self-exams. Usually we say in the middle of her cycle, and do it at the same time every month, because the breasts do change a little bit over your cycle, okay? They may be a little more lumpy towards your period. And what I always tell women is pretend that they're feeling for a frozen pea in their breasts, and if they notice anything, go straight to their doctor. There's no such thing as an unnecessary consultation.
Got it. We spoke about, heart disease, but breast and cervical cancer are also very common diseases in women. How do we prevent this, and how do we also treat it once you are diagnosed with these?
So obviously we want to pick cervical cancer up very early, and we want to pick it up in what we call a pre-malignant phase, or before it's actually becoming cancer, because then it's much easily treated, or it's very easy to treat. And obviously the first thing to do is have your Pap Smear regularly, okay? And as you said, the Pap Smear is a little kind of taking a sample of the cells from the cervix. It's uncomfortable, but it can really be very, very beneficial for you. A mammogram, obviously said from the age of 40 and every 2 years after that. One of the kind of things that has revolutionized cervical cancer or will revolutionize cervical cancer in the next few years is the HPV vaccine. So most cancers of the cervix are caused by human papillomavirus, and this virus gets into the cells of the cervix and can disrupt and cause chaos in the cells of your cervix and eventually lead to cancer. And there are now vaccines that young women can have that can prevent cervical cancer, or most will prevent high-risk human papillomavirus.
Well, we are certainly going to be continuing this conversation around women's health. It is International Women's Day. Dr. Jason Bennett is not going anywhere, but if you do have any questions for us, head on over to our social media. We'd love to answer them for you shortly.
It's my feel-good breakfast show.
Welcome back, everybody. This is your Feel Good Breakfast Show here on S3. And of course, we're continuing with our health discussion this morning. And as science advances, so is an increase in their understanding between the health needs of men as well as women. And as we commemorate International Women's Health Day, the 8th of March, we are joined by gynecologist and obstetrician Dr. Jason Bennett to unpack some of the issues affecting women's health. And one of those issues, and I think it's been, quite evident on social media. I think I saw a post just last week about women speaking about birth control and how they've been on birth control since they've been teenagers, but the negative side effects of birth control, their skin, the hormone imbalances. But let's speak about birth control. What are the different types of birth control out there?
So, Jamie, there are a host of different birth control types available, and not one type fits everyone, and some women have to go through a few different types of birth controls to find the one that suits them, and they will find the one that suits them. Just to name a few, the most common ones are the oral contraceptives, so that's, for example, the pill that you have to take every day. There are some other ones, an implant, so it's a little implant that goes under the skin of the arm. Really good contraception, lasts for about 3 years.
Okay.
They're intrauterine devices, so this is either a copper device, and that can go on for up to 12 years. There are also some intrauterine devices with some hormones inside them, which will make your period stop, but also very good contraception. There are some patches. There are also some rings that you can insert in the vagina once a month. So there's there's a whole array of, and there's also the injectable, which is very popular in South Africa, either 2 monthly or a 3 monthly injection. So there's a whole array of contraceptive choices.
Let's look at the pros and cons when it comes to birth control. What are some of the pros and what are some of the cons when it comes to making sure that you choose the correct birth control for your body?
Yeah, so I think one of the biggest pros is not falling pregnant.
Well, listen, you said it, not me.
Especially for someone not wanting to get pregnant, so you can really plan your family properly. But there are some what we call non-contraceptive benefits that are very important to look at, and sometimes we just use contraception for the non-contraceptive benefits. For example, the pill can regulate your cycle, it can decrease the amount of bleeding that you have, it can help you with the pain that you experience, it can also make your skin look really good, and we sometimes use it to treat acne. Things like the intrauterine devices, the pros are that the ones with hormones we can use to treat heavy and painful periods. One of the other pros of one of the copper devices is that they are hormone-free, which has become very popular these days, and women want something with as minimal hormones as possible, and that's going to be the copper T.
Mine actually had the reverse effect. So before I had Luca, I would bleed for 3 days, no pain. Now, having Luca and still having the IUD in me, I bleed for 7 days. It's quite painful. Does that change after a woman has a baby?
That is very common with a copper T, and it's very difficult to get around it. But with most copper Ts, intrauterine devices with copper, there will be heavier bleeding, and you may bleed about 15% more than before, and it may not necessarily go away completely. It may get a little bit better over the 6 months, but it may not go away completely. Some women may also experience a little bit of pain and discomfort during their periods with the copper device.
We're speaking about the spectrum of not falling pregnant, but there's often women that want to fall pregnant, but they can't conceive. What are some of the common factors that leads to women or the ability to not fall pregnant?
So when we talk about falling pregnant, I always say there's two factors, and one is the male factor and one is the female factor. And I think a lot of people misunderstand that a lot of infertility can be caused by the male side, and there can be problems with the male sperm. So it's always important to check that the male sperm is kind of working. On the female side, there can be a host of problems. Sometimes it's completely unexplained, so no one really knows why they're not getting pregnant. But some other causes are that the woman may not be able to actually produce an egg, or she may not ovulate. For example, something like PCOS or polycystic ovary syndrome. And then we actually have to force a woman to ovulate or give her medications to artificially induce ovulation. There can be problems with a woman's tubes, so the woman's tubes can be blocked either from a previous infection or from previous surgery. There can be problems with the woman's uterus, so it can be distorted, for example, with a fibroid. And then there's also conditions like endometriosis, which is a common cause of infertility when the endometrial tissue sits outside of the uterus. That can cause inflammation and can really decrease her chances of getting pregnant.
There's still two topics I want to speak about, one being menopause and also women's sexual health. And I think we're going to delve a bit deeper into that. So again, if you do have any questions for Dr. Jason Bennett, head on over to our social media. We're continuing our health discussion in just a moment.
It's my feel-good breakfast show.
Welcome back. You're still live here on your Feel Good Breakfast Show. We've been chatting with gynecologist and obstetrician Dr. Jason Bennett as we commemorate International Women's Health today, the 8th of March. Now, whether women are trying to fall pregnant or prevent a pregnancy from happening, women's sexual health is an often neglected topic of discussion, and that's definitely something I want to unpack right now. But I also want to speak about menopause. As women get older, they reach a point in their life where they start to experience menopause. What exactly is it? What is happening to the body at that time?
So menopause is a very important and unique stage of any woman's life. Basically, they stop producing eggs, their hormone levels drop quite significantly, so their estrogen, progesterone, and their testosterone levels drop. They may develop certain symptoms, and some of these symptoms can be quite devastating, and these include hot flushes. They may notice something called brain fogginess, or they get a bit, brain fog, that's what they all describe it as. Then may notice dry skin. Some women feel a tiredness and fatigue, loss of libido or loss of sexual drive.
Hot flushes.
Hot flushes, yeah, and a dryness particularly of the vagina.
Got it, okay. And at what age is this usually happening to a woman's body?
Average age for menopause is about 51, but remember, all women are different, and some women experience this earlier, some women experience this much later. And also there's something called a perimenopause phase, where they're not completely menopausal, but they kind of experience the symptoms over a period of time, and that can actually last for quite a long time.
Okay, got it. So we got menopause out of the way, and then the sexual health topic, because this is something often women shy away from, okay? So how do women take care of their sexual health in today's day and age?
So sexual health is, I think, a very important topic. And as you said, a lot of women are embarrassed to talk about it with their partners, but also with their doctors, and it shouldn't really be like that. I always tell women they need to put themselves first. They need to look after themselves. They need to use safe sexual practices. They need to use barrier protection, have themselves and their partners tested for STDs. And then I think what's important is communication between a woman and her partner. She needs to talk about what is good for her, what is painful, what she wants, what her desires are. And I think having a good communication is really important in a good sexual relationship.
Got it. And of course, as we commemorate International Women's Day today, is there any final piece of advice that you want to leave with all the women of Mzansi out there to make sure that they do their health checks, make sure that they prevent, certain things of happening to them? So any words of advice for women wanting to start on their health journey and looking after their bodies?
I think it's never too late to start on your health journey, and I think women need to look after themselves. I think doing those health checks are very important. I think a Pap Smear is number one. Go and do your Pap Smear, do your breast self-exams, book your mammogram. And if you have any confusion or questions, go and see your doctor. It doesn't have to be a gynecologist, it can be a GP. But really, I think women must really look after themselves.
Thank you so much, Doctor. Always so good to have you with us on the couch. Do those health checks. You heard the doctor, check in on yourself, go out there and make sure that you're putting your health first.